if you could give a couple of words of advice for us, what would you want us to hear from your perspective as being a wound care patient for all of these years? What are some Joe's pearls of wisdom?
Try not to treat a patient like a slab of meat that you're dealing with.
Hello, everyone. Welcome to Healing by Design, the podcast where we amplify the voices that matter most in wound care. I'm Jen Bierhup, and I am here with my co-host, Therese Laub. We are so glad you found us, and we can't wait to dig into today's conversation. Before we jump in, I do want to take just a quick moment to cover a few things. Everything we talk about on this podcast is meant to educate and inform. It's not medical advice, and it shouldn't be taken as a diagnosis or treatment recommendations. Your situation is unique, and your healthcare provider is always your best resource for decisions about your care. The opinions our guests share are their own. They don't speak for PAWSIC or our sponsors. And if any of our guests have professional or financial ties to products or companies we discuss, we'll always be upfront about that. One more thing. If you're ever dealing with a wound care emergency, please don't look to us for that. Go to a provider right away. Now that we have all of the disclaimers out of the way, let's dive right into our show.
So Jen, I am so excited to get started today. We have an amazing guest joining us, and we're going to have a great conversation over this. But first, I want to talk to our audience because I think anybody in wound care right now has noticed, especially over the last couple of years, and dare I say even the last maybe 6 months, that wound care is really changing. There's a lot that we're seeing now that we haven't in the past with AI coming, the documentation tools that are out there. We've seen even a lot just how we measure wounds, right? There's a lot of different things now that are going to be available to us. And it's just been an incredible journey as we're watching this as either providers or nurses that are seeing patients. But one thing I think when we look at everything that's going on that we don't see is the perspective and the journey that the patient has, because it's easy to get caught up in all the newness, all of the technology, all of the science behind it. But seeing a patient and where they've been and how they're going through this journey, sometimes it's, they can't get an appointment. They can't get somebody to see them. They're having a problem getting their dressings. It's difficult in a way that sometimes I don't think we understand. So today we have Joe Balusik, and he has been on an incredible journey since 1995, where he had a spinal cord injury. So he's been in our system for quite a while, and we're going to talk to him about his journey, some things that have been great for him, some things that he may think we could change, and just learn more about what he's been through. So Joe, we are incredibly excited to have you on, and thank you so much for sharing. And welcome to our podcast.
Well, I'm pleased to be here.
Yes, we are so excited to have you, Joe. Now, I'm going to do a little disclaimer so that way the audience understands the relationship that Joe and I have. Joe and I go way back, like way back. Joe, when was that? Probably 2009?
Yeah, you think it was right around 2009. I had just gotten divorced and moved back home to my hometown. So
That's right. Yep.
It was 2009, 2010 maybe.
Okay.
Right around there.
Right around there.
Yeah.
So Joe came to see us in our wound care center, and we were instantaneously. I mean, he just became, of course, one of our most favorite patients. We all looked forward to seeing Joe, but up to that point, Joe was great. Like all of his skin was great up to that point. So our relationship began with really his very first introduction to having a wound, and ever since then, I've kind of been, and some of us in the wound care center have kind of been along for Joe's wound journey. So if it sounds like I know a lot about what's going on with Joe, it's because I kind of do.
Yeah, I mean, in a professional sense, you probably know more than you should. I mean, because over the years, we've become more friends at this point than professional people.
Right.
So, and sometimes that's what's really amazing, right? When you work with patients is to get that kind of rapport. But Joe, let's start. Tell us exactly what happened. Explain to the audience where you got to where you're at here.
Oh boy. Okay. Well, let's go back to 1994. I was 26, and the company that I was working for at the time, I was the big guy. So I did a lot of the toting of barges and moving of bales. No big deal. I'm used to it, you know. And I had some low back pain for about 2 weeks. Nothing out of the norm for me, you know. I mean, young guy doing a lot of physical labor. Back issues were no big deal. But this was a bit different because I started getting a tingling sensation in my right leg. And as the week progressed, the sensation changed to numbness, complete numbness, and very little motor control, gross motor control. I mean, I was literally driving my pickup truck by lifting my foot up and putting it down on the gas and putting it on the brake. I'd been seeing a chiropractor for a while because of the back issues and things, and made an appointment, and they were like, well, let's take new photos. My x-ray technician is not here today because this was like after 5:00 one evening. I said, yeah, I'll come back tomorrow, first thing in the morning. So, and this is December 19th. So go to bed.
Right before Christmas.
Yeah, go to bed, wake up in the morning, and like most people, I go to, sweep my legs out of bed and put them on the floor and get up and stand up and run to the shower and start my day. I couldn't put my legs on the floor. My top half of my body literally fell out of bed and hit the floor. And I said to my wife at the time, I said, hon, I think we've got a problem. Something's not working. Move forward a little bit. I called my best friend for some help because I figured, if I can get to work and I can get to the chiropractor, I can get this ironed out. Maybe I just pinched a nerve or something.
Oh, no.
So he came over and we brainstormed how to get my butt in the truck. And it was kind of like, I don't think this is going to work. So I immediately reached out to my folks. I said, what should I do? And they're like, go to the hospital.
Right.
Get to the hospital, get checked.
Yeah, go to the ER, please.
Yeah, something is big time wrong. Go. So that's what we did. That began the slow precipitation of the tingling sensation moved across my pelvis and down into my other leg. And everything was gone by that afternoon of the 20th.
Oh, my goodness.
I mean, just gone. Yeah.
Oh, my goodness.
I've had pretty much every test known to man neurologically to figure out what it was. And at that time, very, very few cases of transverse myelitis were known. And that is my official diagnosis, transverse myelitis with indeterminate etiology. Big fancy phrase for, we don't really know what happened.
Right. Yep.
They did find that there was about a dime-sized lesion on my spinal cord where the myelin sheath was worn away in about a dime-sized area. And they don't really know what caused it. They don't know if it was viral. They don't know if it was physical. They just don't know.
That's scary.
You're telling me. I mean, my life changed in an instant.
Oh, yeah. And you're 20 and you're 26, right?
26.
I mean, you're 26.
Married 5 months.
That's right.
Oh, my
Yep.
gosh. You were just married.
You just married. And so I looked at my perspective on the world changed, and it was just like, what do I got to do to get back to living normal life? Just tell me what I have to do and I will do it. And that's the way I attacked rehab at MCO at the time, at University of Toledo Medical College, and was fortunate enough to go through a great rehab program there at the time and learned all the skills that I needed to learn to live my life in a wheelchair in record time. They had actually never seen anybody go through the program that fast because I was driven, I was determined, and went back to work because at the time I was working as a screen printer / graphic designer. So I was fortunate to be able to go back to my job. So I did. And that was the way things were for quite a while. Actually made a career change while I was there for the better. Ended up having an opportunity afforded to me to go to work for Owens, Illinois Glass Corporation, working in their screen printing department. And then that led into doing CAD/CAM design for glass containers in their glass division, where I spent the last 26 years.
Yeah. And Joe's designed some really super cool, Joe, quickly tell them about the super cool bottle that you designed. And that was your design. And I want to hear, I always love hearing Joe's bottle stories. Okay.
Yes.
Well, Well, it's not very glamorous. I mean, a number of years ago, Miller Brewing wanted to do something unique with their Miller Lite beer bottle. And we had been kicking around an idea in our development area is how can we get the beer? And this, I shouldn't say this because we don't really want to do this to the alcohol industry, but we wanted to get the beer out of the bottle faster. I mean, there's a stigma about binge drinking and things like that. And that's a very real concern, but we thought it'd be kind of cool if we could figure out a way to evacuate the product out of the container faster. So myself and my team leader at the time, we kind of kicked around this idea that what if we put some striations in the neck of the bottle to give it a little bit of oomph. And we experimented with a few things, and I came up with this way to do it. And we ended up putting a little corkscrew ridge in the neck of the bottle. Miller loved it. They called it the Vortex bottle. It was a big marketing push for them for the better part of 2 years. They were putting it on their NASCAR graphics for their NASCAR sponsorship. I mean, it was a big deal.
Yeah,
and
that's so cool.
It sold really well for them. Mostly because we were also able to put real data behind the fact that it actually did help the beer pour faster. So,
that's amazing that's a thing. They want beer to pour faster.
Yes. And, consequently, once Miller's option on that ran out, because it was our technology, but once their option on it ran out, we were contacted by some wineries that wanted to do the same thing. To help
because wine should come out faster too.
Yeah, and it helps aerate wine. Right? Yeah. The nice thing for wine is it helps aerate the product.
Yes.
And red wines especially like to have extra oxygen. Let's let the wine breathe. Well, having it able to flow out faster and get kind of rippled while it's doing it helps that even more. So there were a few Australian companies that grabbed onto it real fast and said, we want to use this too. So.
That is so awesome.
That is impressive.
And then that led to a couple other adaptations of the technology and whatnot. And it was kind of cool.
And then you also did the super quick, because I know we're getting off on bottles, but I want to give credit out to where credit's due, because Joe was a big part of the Sobe
beverage, lizard.
The lizard.
Really?
Yeah.
Yes.
No kidding.
Yep.
So. Yeah. I've got a couple cool little feathers in my cap that I'm quite proud of. Not
you're
bad.
Famous. I
know.
Nobody knows who I am. I mean, I'm just
now we do.
Well, yeah. I mean, what kind of a reach is this going to have for me on a personal level? Not much. Yeah, and I'm not worried about it. I've always been a team player. When I was in high school, but I was a football player. I played line. So we got no glory. We just did all the dirty work. Yeah. So I'm used to that. I'm good with it.
Did you play in college too? Remind me.
I had an opportunity. I was recruited, and my quick story there is I showed up on campus, did my campus tour, and I said to the gentleman taking me around, I said, "So where's the art department?"
Oh.
And this particular school is known for their science and business programs. And he flat looked at me and said, "I don't even know if we have an art program."
Oh.
And I said, okay. Well, met with the coach, and the coach is like, we'd really love to have you here. And, we think there's a place for you. And I said, well, I don't know if I can be here because I want to study this. And, I'm looking to trade my education for my sports ability. And if I got to study something I don't want to pursue just to play, I don't want to play. So
and there you go.
I turned down an opportunity so that I could pursue what I wanted to.
Well, and that was important because obviously you created beer pouring faster.
Well, not bad for a kid who studied drawing and sculpture in school.
It's not bad at all.
I mean, I literally fell backwards into this job. So, but I mean.
But what's funny is that a part of your we can talk about this, but a part of how you got into that job was, having friends that also were wheelchair bound as well.
Yeah. I was able to get that opportunity because I became disabled. I would have never had the opportunity if it hadn't have been for ended up in the chair.
Yeah.
That's pretty cool.
The person that I met, I would have never met. And, that as fate works out is often strange. and beneficial.
Yes.
So,
Right. Exactly.
That is
exactly.
so cool. So
Yeah.
going back, Joe, I have a question after you shared what happened in 95 and I just can't even imagine what that would have been like trying to deal with that. Oh my gosh, being young, being just married. But I'm curious because, times have changed since then in our healthcare system, but did you struggle with care? How did it go? Were you in a facility for a little while? Did they,
um,
or was most of your stuff outpatient or?
the only time that I spent, I spent like 2 weeks in actual acute care at UTMCO. And then they quickly moved me into their rehab pavilion. And at that
So you were
time,
doing like acute rehab.
yes, I was
Okay.
inpatient rehab, and it was every day. There was physical stuff every day. There was occupational therapy. There was occupational, physical, and there was one other aspect.
Well, you wouldn't have had speech.
No, I wouldn't have had speech.
Yeah.
Yeah, he wouldn't have had that. But
Drawing
I mean,
a complete
in all
blank.
reality, Joe, you had great skin. I mean, you were 26. We were healthy.
Yeah, I
So-
did not have any issues until you guys met me
Right.
in
And that was
2010 or so. So that was almost 20 years.
Yeah. So you had, you were great. And Joe, the story you told me about was that, because Joe can't feel. So like, that's the thing, right? He can't feel it. And it's hard for you to look on your own backside. But Joe, tell me the story of when, cause you thought you thought that you were sweating or something because it was the drainage that was kind of alerting you that something was wrong.
Yeah. I'd started noticing that frankly, my pants were messed. And it wasn't through the usual channels. And I'm like, what's going on here? So I'd feel back there and I didn't feel anything out of the ordinary.
Right.
But this drainage was appearing from somewhere or seepage, whatever you want to label it. It just was there. And I'm like, this is not good.
Yeah. And how long was that before you came? Like, when did you?
It was a couple of weeks.
Okay.
I mean, I was, putting up with it because I just figured, it's something weird. It'll just pass. I didn't think to go and see anybody about it until it got to the point where it just never seemed to stop. I said, well, I guess I better suck it up and go see somebody.
And you had a belly. You had a
yeah, that was an odd thing. Kids, be very mindful of your zippers. Because I left the tab, the zipper tab was actually up and it got past the little flap on your pants there.
That's right.
And it cut the underside of my stomach because, as the years were progressing for most people, you put on a little bit of weight. And as a sedentary person at that point, I was no longer doing any kind of athletics. I mean, I dabbled in wheelchair sports when I first got disabled. That lasted only maybe 4 years or so. So I put on a little bit of weight and I noticed, I cut myself. And I'm like, where did I do this at? And then I realized, it was from the zipper. And always make sure your zipper's tucked away properly.
Yes.
So I had this nice cut underneath my stomach. And of course, I also went and saw somebody about that. And that's what got me actually initially into the system.
Yeah, right.
As far as care
goes.
Because my regular physician was caring for it at that time. I wasn't seeing anybody for wound care. But as my rear end started to deteriorate, that's when that portion started. So
right. And I feel like you, ever since then, I mean, you've had stretches where that bum has stayed intact.
Yeah, I figured
but I just feel
that.
I feel like it's just been this roller coaster for you. And when I say roller coaster, I am not joking. Like, I mean, we were able to, we got you. We did get you healed, didn't we?
Yes,
we got that bum healed because we were laughing about
We transitioned to the surgical.
That's right.
Okay. You guys got it to a certain point where it's like, hey, it's small enough that we can close this with a minor surgery.
Okay.
And we should be good. And that turned out to not be the case, but that's a whole other story.
Yeah,
in
we'll
and of
talk about
itself.
that because I know we got you to where it was really. In fact, we used to laugh because we know we'd take pictures of it, and I mean, yeah, this is a long time ago. So we would show Joe, and then we would talk about the various stages of granulation of steak. Like, at what point
Yes,
we were trying to describe
what's good, what's bad.
what's good, what's bad. Is this something you can throw on the grill?
Yeah, and as a patient, that's what you want to hear. You want to hear that feedback. Like, am I doing things right? Am I making what you're doing as far as the caregivers want? Am I succeeding? That positive feedback is something that I was desperate for, because as a former, and I don't want to say I was a former athlete, but I mean, I frame a lot of stuff that I went through as getting ready for a game. There's a headspace that you kind of want to get in when you're trying to heal a wound or heal anything really. And it's battle. You've got to be in the right frame of mind. And, I would be to Jen and the other girls. It's like, what are we seeing? Am I doing what you want? Am I doing the right stuff? Are we seeing positive results? So,
I not to interrupt you, but that's an important thing I think that you just said, because I think as providers of patients with wounds, we need to understand that that's an important piece where the patient has to be in order to accept the training, the education. You need to understand, right? What's going on and where am I at? And is it better? Is it worse? What do I have to do? So I think that's a great comment for people to hear. Absolutely.
I can't agree more. I mean, it works for me.
Yeah.
I don't know if it'll work for everybody, but I think, everybody wants to know if they're doing the right stuff. Yeah. Are they succeeding?
Right. So, and Joe was so great because we would say, okay, more protein, this and this and this and that. And he's like, I'm on it. I'm doing this. I'm doing that. I'm doing this. And, and he did progress and we made some leaps and bounds. I think we had a couple of setbacks, but, every single thing that we would talk to Joe about, he did. And so it was for us we were talking about this prior to recording, or maybe we already recorded it, but, for us as wound care nurses in a wound care center, Joe came in with such a light. He came in with we laughed hard every time he came in, and he was so willing to be a part of the healing team. Mm-hmm. And so he brought so much light to us as the nurses there. I mean, he brought so much forward momentum for us because we have so many patients, that either feel helpless or they just don't know, or they just are so out of control. And Joe was like taking control. And that meant everything to us. Like it gave us the strength to move forward to the next patient and the next patient and the next patient. So, I will always be thankful for Joe for the relationship that he gave to us and that he allowed us in, to move him forward and kind of be a part of this journey with him.
You guys were a true healing team is what that sounds like it came down to.
Oh, but they were great.
Yeah.
That's good. That's good. That's awesome. Mm-hmm. But I missed it, or maybe, I don't know if you said, when you went in that first time and you met Jen, where were you at with your wound? Was it staged or how bad was it?
You can probably speak to that a little more, Jen.
I think you were stage 3.
I know it was pretty bad.
So you were stage 3. I think we weren't sure about osteo situation. We weren't really sure. And I don't think, and we can start down that road because there is a road there, but.
Well, I think that's an important road too.
Yeah. Mm-hmm. It is.
A coccyx wound, right? Is that coccyx or sacral?
No, this was an ischial wound.
Oh, you had ischial?
Oh, yeah.
Right
Yes.
Ischial protuberance.
Yes, he was an ischial. That's right.
And there were actually 2. There was one in each buttock.
Yes. That's
tough.
So,
those are tough areas, man.
And the funny thing is the one in Jen, this is where I think you got the remembrance a little off. The right side healed completely naturally.
Oh, yeah. Oh, okay.
The right side, I mean, just cooperated and just jumped right in and just healed. And, it went from mildly healing to, hey, Joe, this is beefy today. Your butt looks beefy. And we were like, yeah, all right, cool. And it skinned over and everything was just great on the right side. The left side, was the one that
Not so much.
just did not want to cooperate fully. It would go and go and go and go and go and go. And then all of a sudden it would stop. We'd hit a plateau and we didn't know why. And
That's right. That's right.
we had wound vac going on. We had all sorts of different modalities happening.
Right.
And
Tell me a little bit about the wound vac. And you were still working.
yes, I'm still going to work every day.
Yeah. You're still going to work every day.
So I'm transferring out of my wheelchair because at that time I was driving a 4x4 Chevy Blazer. So I'm lifting myself out of my wheelchair and behind the wheel and breaking my chair down and putting it in the seat beside me and driving to work and then repeating that to get out of the vehicle, spending 8 hours a day at work and repeating the cycle to go home. And then, living a life. I mean, visiting with friends and going here and there and, terrorizing the world as I do. And, life was just good. Even with this going on, I remember speaking, because it's St. Patrick's Day tomorrow when we're recording this. I remember with the wound vac on my rear end, going out drinking with a couple of buddies for St. Patrick's Day. With the wound vac on, and just, having a good time.
With a corkscrew bottle so you can drink faster? No,
I'm kidding. We weren't there yet. We weren't there yet. No. That wasn't on the horizon yet. So, but I was determined to be as normal as possible going through all of this. 'Cause it's like, this is just a thing. I can get through this. I can do this. So it wasn't holding me back. Now, should I have probably done the smart thing in hindsight and put myself on the shelf and gone completely bedridden and not done any of that? I don't know. But that wasn't on the table.
Yeah. And, we talked about, and so the group, he had a name for us, but we won't necessarily say the name out loud.
Wait, we can.
I think we should.
We can. I mean, I called Jen and the team, since they're all women, except for the doctor who was overseeing my treatment. I called them my healing harem.
Oh, there you go.
And we did not. There was none offense. There was no offense taken. We loved being Joe's healing harem.
Healing harem. I love it.
So
the HH group.
And again, they were all wonderful. So it felt like these were good people, and it's like, I want to be part of this group. So.
And he was, but we had all these discussions in the background that Joe didn't know about, because we were like, what do we do? Do we tell Joe to take time off of work? And I think we even had some discussions, like, do we, we got to get him the right wheelchair cushion. We have to do, and then I told him the story yesterday about watching him getting in and out of because he had a little pickup truck too. And so all of us, it was very important for Joe to be Joe and not take any of those independence. We didn't want to take that away from him at all. Like we struggled to try to figure out, okay, do we tell him, he needs to put himself on the shelf, or do we not? But we would watch him get in and out of his little pickup truck, and we would watch him scooch over into his and then throw his wheelchair.
And I used a transfer board to get in the truck. I didn't use one to get out because gravity does most of the work. But, I'm sliding a transfer board underneath me, and I'm, scooching up just like you're taught how to do, and away we go.
I know. And so we're watching that. We're watching him doing all this scooching, and we're all watching outside the window, and we're all going, oh, Joe. Oh, but we weren't, it's like, gosh, what's the balance, right? And I think that's the biggest thing with patients. And it's the biggest thing is that, as wound care patients, we take so much power and autonomy away from our patients. Don't walk on your foot. Don't go to work. Get off your butt. Don't do any of this stuff. So what was the balance, right? What was the balance for us for that? And we did not want, we struggled to take all of that away. We just
That's
didn't want to.
another important thing. Absolutely. You have to work with the patients and where they're at, right, in their lives. Because, you don't want to make them incapacitated. I mean, they are already, right?
I know.
Like to take away the normality of life, that is rough.
Yeah. Yeah, absolutely. But I think,
Go ahead.
No. You go right ahead.
No, I was just curious. So you had that going on. I'm assuming you had the vac on at the time, right? As this scooching around. So did it get better with the vac, or I know you went down a road of osteo, but I'm just curious what happened at that point.
At that time, I think the vac was doing exactly what it should have been doing.
Okay, good.
We were seeing improvement, and you guys had reached a point where I think the vac could have come off for a while. In fact, I think it did. You guys kind of cleared me from it, and that was a great day because I was able to stop, lugging this, and it wasn't huge. The little pump is not huge, but I wouldn't have to worry about it anymore. I wouldn't have to worry about having my drape be intact.
Right.
And if I'm using words that people don't know, you guys can jump in and help define some of that stuff, because I'm sure everybody that this goes out to is going to know what wound vac drape is. So, not having to worry about that was a huge load off my mind, because there's nothing worse than, doing your thing and all of a sudden you hear the of the pump stop.
And then
and especially if you're at work, because now it's like, oh crap. Now it's not doing its thing. And I was the type of person that I'm at work. That's what I'm supposed to be doing. I'm supposed to be at work.
Right.
So leaving work for stuff was not something I enjoyed doing. I don't like leaving my boss or my team in the lurch. So it's like the last thing I wanted to do was say, I got to go. Now, fortunately, when those sort of things happened, I do remember once in particular that the clinic was only about, I'd say maybe 6 miles from where I worked up the expressway. So it was kind of like, I gotta go. I gotta go see them. If they can get me in, I'm going to go and have this repaired, and then I'll be back. And that's what happened. I called the clinic and they said, yeah, we can get you in and see if we can get it reapplied. And over my lunch, I went in. The girls, I got up in the chair and flipped me over and took everything off, put brand new back on, and patted me on the head and said, good boy, go back to work. And away I went. Bob's your uncle, happy day. So I was very lucky that I had good caregivers that understood where I was at, my goals.
And you had access too. Yeah.
And I had access. And
that's, yeah.
And the other thing that I think is real important is I had a great support structure in my private life. I had supportive, I had supportive parents that were, they didn't want this to happen to me. They didn't want this going on. So what do we need to do to help you get through it? And they were always some of my best cheerleaders anyway in my entire life. So, being back home and not under the circumstances that anybody wants to be under, to go through this on top of that, I was very lucky. So, that's important. And a lot of people don't have that support structure in their private lives. They're usually relying 100% on their caregivers to help with that kind of stuff. And I was very fortunate. So
that's very, very true. Now, so fast forward. So for that ischial wound that didn't close, was that the one then was that the first rotational flap?
Yes.
Okay. All right. Well, let's talk about that a little bit, because that was, boy, oh boy, that was a journey.
Yes. So after I left the girls at the clinic and got transitioned to the surgical team at UTMCO for the surgery, and the doctor who did that procedure, she was wonderful. I don't know if I should be mentioning names, but let's put it this way. She was great. She was very upfront, very clear about everything. And even leading up to the surgery itself, we were still undergoing treatment. I was getting different granulated materials put into the wound to help speed healing. Because if we could avoid the surgery, that would have been ideal. But as we were going, it looked more and more like the surgery was going to have to be the option. So it was broached to me to have a partial rotational flap done on my left buttock. And I don't know if everybody knows really what that is, but as I understood it at the time, they were going to basically slice me open on my left buttock and take some of the material from my underside of my left thigh and rotate that up and basically reconstruct my rear end, my butt cheek. And that was going to put me out of commission for at least 6 weeks. So once the surgery is done, it's going to take a 6-week window to completely heal. And that involved being in a clinitron bed, the big sand flotation, which was an experience in itself.
I can imagine, man.
Yeah, they're very hot, they're very noisy, and they're very lonely because it's this big. I called it the bassinet of doom because that's what it looks like. It looks like a big bathtub.
I remember this now. The bassinet of doom.
Yeah, the nice thing about it is I wasn't on my stomach for this entire time. I wasn't, being rotated. The full flotation of the sand does its job. And I was really kind of comfortable, but it's not fun. So,
and that was 6 weeks, six solid weeks. Yeah.
So, was that at your house? Did they bring that to your house?
No, I was at UTMCO for that entire 6 weeks.
Oh, you're in. Oh my gosh.
Yep.
Yes. It's really kind of cost prohibitive to rent a clinitron bed for a home. I mean, it's very rare, as far as I know, to have that happen. There are very special cases that require that sort of,
That's
stuff.
True.
That's true.
That's
true.
I have seen it though.
My private insurer was not going to pay for something like that.
They're expensive for sure.
That's a big no.
Yeah, that's a big no.
That's a big no.
So parallel to the healing portion is, there's a big team that's working with you. There's the surgical team, and there is the infectious disease team. They're monitoring, or they should be monitoring, any kind of infection potential going on in and around the wound as it's healing. The gentleman that I had working the infectious disease angle, and I'll just be honest, dropped the ball. I think he made some assumptions that did not pan out properly. I was on antibiotic the entire time, but I don't think it was the right antibiotic for what was really going on. I don't think it was identified. So, of course, the proper decisions weren't made. As all this is going on and the wound is closing up, and as I'm getting cleared for each stage, I can start sitting, I can start getting back in my chair, I can start doing some physical stuff to get ready to get out and go home and get back to life. All the while underneath here, there's the infection cooking way in the background. Roughly 8 to 12 weeks post-surgery, I'm getting ready to transfer out of the driver's seat. And at this point, I've gotten rid of, at the time, my Kia that I was driving, my 4-wheel drive vehicle, the truck. And I transitioned into a van. My folks were like, you really should get a van. Just suck it up and get a van. And I can go into this as a side tangent as to why I resisted vans for so long. But that's really kind of not the important part. So I'm behind the wheel of the van, and I'm getting ready to get into my wheelchair to get out and go in the house after a day of work. And I'm like wet.
Oh boy.
Here we go again. And I'm thinking, and I'm going to be blunt, did I pee? Because that happened. Well, I straight calf 3-4 times a day. And sometimes at work, I didn't calf all the time. Because it's like, it takes me away from something, or I'm involved in something and I don't have the 15 minutes to go and take care of this. So I would just kind of say, I'm just going to stop drinking the rest of the day and I'll be all right.
Because that's how that goes, Joe. Because that's a...
What's that?
We're not... Because I can say all the clinicians that are listening are going...
Yeah, they're probably pulling their hair out. And I'm sorry, but this is reality. This is the way you live. I mean, things
Right.
things get missed and things you take shortcuts, and it's not always the best in hindsight, but you don't really realize that as you're living.
No, but I think it's great. I mean, we
Yeah.
need to hear this. Like, you have to live your life. You're at work. The
I mean,
idea of having to stop your life to go self-cath is...
The little voice in the back of your head is saying, you should be cathing. It's reminding you, but you're consciously ignoring it to do whatever it is you're engaged in at the moment. That's reality.
and that's very real. Absolutely.
I know I'm not the only person that has done this.
Oh,
I know
gosh.
You are not. No, you are not. No.
So anyway, I'm freaking out at this point. It's like, where is this coming from? I'm going through all the motions. I'm trying to figure it out myself, and I'm like, what's going on here? Go in the house, and I reluctantly tell my folks, "Oh, I think there's a problem again." And they're of course they were actually more upset and let down than I was. Because they're immediately thinking, "Oh, here we go again. What's he going to have to go through now?" So I immediately reached out, found out who I could see, went back to my doctor at UTMCO, and I said, we need to be seeing something going on here. Went in for an exam, and the determination was made by her and her folks. There was an infection that did not get seen, and it completely discombobulated everything. It basically undid the surgery.
Yeah.
And
So
I'm
there
like,
was an underlying osteomyelitis, right,
Yes.
Joe? There was an underlying bone infection that was not completely caught, that wasn't caught,
and wasn't
and
treated.
wasn't treated the way it needed to be treated prior to doing that rotational flap, which
Or
was
even during the surgery and the recovery. So,
Right.
so it's percolating this entire time.
Oh my gosh.
And the decision was made, or the recommendation was made. You need to have the surgery redone, and we need to do a full flap.
Oh,
And
wow.
you guys, know what a full flap is. Do you want to tell the audience what a full flap is, or I can do it?
I think you should do it. I think they should hear it from you. I think that would be great.
So here's what I was presented with. Joe, we're gonna take your left leg off at the hip, and we're gonna leave your what muscle group is it? It's the top of your thigh. We're going to leave those, but we're going to use that and fold it under and do a true flap and build a butt cheek with your top thigh muscles. And I thought about that for a few minutes and went, you're going to take my leg.
Right.
Now, remember, I'm a T910 paraplegic. I don't have any function or form or feeling or anything in my legs, but they're mine.
Right.
I came into the world with them. I want to go out with them. So the last thing I wanted to do was sacrifice a leg for this.
Oh, man.
So the big thing in my head was, do I have to do this? Is there another way? They were very adamant at UT that, no, this is what's got to be done. It's the only path. It's the only thing that can be done. When do you want to do it? We can schedule it and we can get it done, and you can start the healing process all over again. Think about it, another 6 to 8 weeks. And
Stuck in the tube of, or in the tub of doom.
or some other torture device that masquerades as medical care. I was like, what do I want to do? So, of course, my first plan of attack was better go home and talk about it. So I went home and I said, here's what they want to do. My dad kind of did one of these numbers. Said, I think we better get a second opinion. And so he says, U of M is pretty cool, and they're just up the road because, I only live right across the border in Michigan, and Ann Arbor's 20 minutes away. And he said, let's find somebody up there we can talk to. So I did a little bit of research and found a name to contact, and it was a gentleman in their plastics group. And I made an appointment for a consultation, went up and saw this gentleman, and took my parents with me because I thought, well, they need to be in the loop too, because frankly, this affects them as much as it affects me. So we're in. He has me get on an exam table, and I roll over, and he checks everything out, I roll back over, sit up, and we're talking. And he says, here's the good news. I can fix this. And you don't have to lose your leg. I'm like, really? And my dad immediately was just, I mean, he was giddy. My mom, I think, was more relieved than anything. I mean, she was just quiet and like, thank God. And my dad was ecstatic. I was intrigued. And I said, so what is going to have to happen? He goes, well, here's the deal. It's going to be a big commitment on your part. I says, okay, what does a commitment mean? He goes, it's going to require 2 surgeries. I'm like, oh, okay. He says, the first surgery, we're going to go in and we're going to clean your wound bed out. We're going to get it as pristine as possible. If we find anything that's necrotic or compromised in any way, we're going to get rid of it and start fresh. He says, I've got a cancer doctor that I'm friends with that helps me do these sort of things. She's an expert on bad tissue, and she's going to be on the team while we're in you, and she's going to help identify stuff, and we're going to clean it out. If we have to resection some of your thigh bone, we will, and we'll go from there. And you will heal for a number of weeks, and we'll go back in once we determine you're clean, and we'll rebuild the area. I'm like, oh, okay. He goes, so what we'll do is we'll sequester you here in Ann Arbor at some rehab facility up here, and that's where you'll be in between surgeries. I'm like, okay, so I'm going to be moving to Ann Arbor for how long? Oh, probably 6 to 8 weeks between surgeries. Like, okay, interesting. Can I think about it? Yeah, absolutely. Think about it, because it's going to require a big commitment on your part. Like, okay. So we went home, immediately started an antibiotic regimen, to prepare. A couple of MRIs later to chart progress in that regard, and scheduled the first surgery in I think it was like March. Can't remember the year exactly, but it was, I think it was almost 10 to 11 years ago. Had that first surgery, and everything went swimmingly. When the 2 doctors were in there, they kind of recognized the fact that it wasn't as compromised as they feared. Nothing had to be cut out and removed. They basically just went in, as he put it, with microplanes and other grading material, and just, sanded down all my bone to new material, essentially. They just took all the crap off. And we called that a day. So, got locked away in Ann Arbor for my time. The next surgery got scheduled, and I went in, and they rebuilt everything. And as the doctor put it, he says, I shouldn't have to ever see you again.
Wow.
It was like, awesome. And, I had follow-up visits, of course. And when he finally released me, that's what he said. He says, I should not have to see you ever again. And
That's amazing.
He's since retired, so I'll never get to see him again anyway. But
Yeah, right.
but I mean, it was by all measures a complete success.
And it stayed a success.
Yeah. So fast forward to 10 years, post surgery, my life is just going gangbusters. I'm having personal success. I'm having professional success. Things are just, chugging along. Life is good.
And you've had no wounds since then?
I've had no.
Up to this point, I've had no issues at all.
No issues.
That's amazing.
Yeah. Just before COVID, changed the world. I lost my parents. They passed away.
Oh.
So because this is important, it all factors into this. At that time, again, I'm living in my childhood home, helping take care of them in their ending years. Because my mother had a stroke, unbeknownst to us. She had identified a brain tumor, and in the surgery to remove the tumor, she had a stroke in the recovery room, which left her paralyzed on the right side. So fortunately, I was there living there, and I was able to help take care of her with my dad, because my dad was adamant about her not going to any kind of home, and she's staying here with us. I'm like, I'm all in, whatever we need to do, I'm there. So I'm balancing work, helping take care of my mom. And at the time I didn't know this, because my dad is one of those old school silent generation people that you're not going to know any of his health issues unless it's horrible. And he's already had a couple of heart attacks and a few stents put in. No big deal. I mean, it happens every day in America. But he ended up being diagnosed with prostate cancer, and he was being treated. He was having a subcutaneous radiation pellet or whatever. I don't know everything about it, but he was doing that. But when my mom went down, he decided that it was more important for him to be home taking care of her. So he stopped. And while I'm in Ann Arbor for my second surgery recovery, my dad had to have his hip replaced. So I one day while I'm in rehab doing stuff, I get a video from my sister. Hey, look, Dad had the surgery in the morning and he's up walking around that afternoon. Where it used to be you didn't do that. Now that's normal procedure. So I was like, get him, Dad. Yeah. But he still needed to have rehab after that going to make sure that things didn't stiffen up and do all the bad stuff. Well, he stopped going to that too. And it was ironic because the rehab hospital my mom was at very briefly was at Flower Hospital in Sylvania. And his physical therapy was across the parking lot at Flower Hospital proper. So while my mom is across the parking lot, he would get up in the morning and go see my mom and sit with her all day. Never once went over across the parking lot for his physical therapy and came back. He would just not go.
Be with her the whole time.
Yeah, he was with her in 24 hours a day if he could be. And that started to take its toll on his mobility. So now, I'm in a wheelchair. My dad starts struggling with mobility issues, and he was not nearly as prepared for it as I was. I mean, he was an athlete too, but he's at this point 70 some years old.
Exactly.
He's just not able to do what he used to do, and it really started to wear on him. And then you combine that with the fact that he stopped his cancer treatment, unbeknownst to any of us.
So you guys didn't know he did that?
We did not know.
Oh.
Until he had an episode one evening that necessitated him going to the emergency room. And that's when my sister, who went with him, found out that he had stopped his treatment and it was starting to take its toll. And in fact, some follow-up visits, long story short, he found out that the cancer was starting to spread to his brain. And we knew then that Dad doesn't have much longer. So he entered hospice at home. And he was there with my mom the entire time, and then passed away in, God, was it May, I think, of that year? It was before COVID, the year before COVID. So he passed away in May, and my mom didn't stay much longer after that. I mean, the old adage, she died of a broken heart.
Right.
That's the bottom line. They didn't want to be apart. But anyway, so at that point I'm like, okay, well, what's going on? So I'm there at the house at the farm, and through the process of dealing with the estate and everything, my sister and I kind of talked about, well, what do we want to do? Now, our farm is a 40-acre farm, and the house sits on 7. So it's like, here's a 3-story house that I can only access 1 floor of. And it's like, this is not practical for me. And my dad has always been one of those, like, someday you should build a house that's perfect for you. Get the things in it that you need and have it done the way you need it to have it done to live your life comfortably. So I've been kicking this idea around for a while, doing up some drawings, because I did drafting in high school. I'm good with that kind of stuff, and started working out what I wanted in a house, and talked it over with my sister. I said, so what are we going to do? She said, well, I want the house. I want the farm, because they were living in Toledo at the time. And she said, I want out. I'm like, okay, here's what we'll do. You take the house and the farm, and I'll take the financial part of the estate. and I will use some of my money and build a house. Okay, sounds good. So that's what we did. No fighting, no issues. It's just that's what
Nice.
we did. So I started the process to build a house, and that started pretty painlessly. And in about 8 weeks, no, not 8 weeks, it wasn't even 8 months, I had a house built. So I, moved into my house, and then all of a sudden, after a year, I started to gain weight. I mean, precipitously gain weight. I didn't see it. Everybody else did, but I didn't. I had some time where I was literally working from my bed at home, because at this time, COVID has got us all working from home. And this is post-COVID. So I had nothing to do with COVID. What happened to me? It was just something went kablooey, and I was fighting this infection, it seemed, and it was always a low-level sort of thing, but it wasn't affecting me to my activity. One day my sister gets a hold of my college buddies and says, it's time for an intervention. Something's wrong with Joe and he doesn't see it. So get down here. Now, I went to school in Michigan, and all of my buddies are from the Detroit area and various places. So they all came down. They showed up at my house en masse.
Wow.
And
That's cool.
they all appeared in my bedroom. I mean,
Oh,
I didn't know this was happening. All of a sudden, there's two ways to get to my bedroom in my house. There's one through the living room and one through a closet and a bathroom and whatnot. And they all showed up. And I'm like, what the hell's going on here? And my sister says, you're going to the hospital right now. We've already called the ambulance. You're going. And I'm like, why? You don't see it. You are huge. I had ballooned up to about 400 pounds.
Oh my gosh, Joe, I didn't know that was 400 pounds.
Yeah. But again, it was so gradual and so slow. I did not see it. I just didn't know. The only issue that I had is it was hard for me to get in and out of the chair, to transfer from the bed to the chair and in and out of the van. That was it. But I figured I'm older. I'm getting a little weaker. I'm not as active as I was. No, it was bigger. So here I go off to the hospital. And while I'm there figuring out what is happening to me, the immobility of the whole situation at the hospital started to eat away at my rear end again. And as we know, pressure sores work from the inside out, and you don't know it's there until it's there. And that's what happened. So,
but Joe, you were sick. I mean, let's be fair.
You actually are a little more knowledgeable about how sick I was than I actually did.
Yes, he was he was ICU, septic, kidneys failing, and that's why he was putting on those weight. He just didn't realize it. And I remember getting a message from his sister, and it was about a week of touch and go. We were not sure if Joe was going to actually make it. We really weren't sure. Mm-mm.
I mean, it was a very scary part of life. I mean, very scary moment. So anyway, was able to make the recovery while I was there as far as the septic situation goes. And they cleared me to go to a step-down unit. And while I was at the step-down unit, they were mindful of the pressure sore building up, and we were treating that. They were as aggressive as they could be. But again, you're still kind of limited with what you're going to be able to do. It was recommended that I go to a different facility for physical rehab, because they didn't really have a good physical rehab department at this place. So we looked at a couple places and made a choice based on proximity rather than quality of facility, if you know what I mean. While I was at this place, and I was being assured that, well, we're going to get you an air mattress, we're going to get everything that you need to help get you healed from this rear end situation. on top of getting you your dialysis every day and whatever else you need.
Because we're now doing dialysis.
Yes. So yeah.
Wow. That's a lot.
So while I'm there at this facility, the wound is descending even further into anarchy. And it got to a point where I ended up going slightly septic almost again, having to go back to the hospital. So here I go back to the hospital. They treated me again I think I was there for 3 weeks or 3 additional weeks. And we chose a different facility for rehab at that point. Got that all cleared up and ended up there. And I was out in a facility out in Oregon, Ohio for another, I think it was 12 weeks.
Mm-hmm. Yeah. No,
Consequently, I was having my rear end treated there as well. Went back on a wound vac for a while. Made enough progress that it was kind of like determined, because here's the battle that's horrible about healthcare: insurance. I love insurance and I hate insurance because your care is not in your hands and it's not in your doctor's hands. It's in a bean counter's hands. And if they decide for whatever reason that they've had enough of paying for whatever treatment is being recommended, they'll just stop. They'll just say, nope, you're done. We've determined that you've healed enough.
Right.
And that's what happened.
Yeah.
So then they said, you're done. You have to go home now, period.
Right.
So I was like, that's fine. I'd rather be home anyway, because frankly, this place sucks. The food's awful. The people are crazy. And I'm not just talking about the fellow residents. I'm talking about the staff. I mean, they're just nuts.
So I want to cover a couple of things though.
Sure.
So fast forward, you had a leg wound too, because his legs were like balloons, right? So there was the water goes out the path of least resistance. So he had some leg wounds as well, and used some compression and got those healed up.
Well, the funny thing is they kind of think that that's where the infection found its way.
Oh, the leg
is the leg.
Really?
Yeah, they think that might have been the path. Is that
really? Well, it wasn't good. It was ugly.
Yeah, when I was seeping all of this, what I don't know what the fluid is. Is it lymphatic fluid when you go septic like that?
There's a whole host of things there, but
that's what they think, is that there was a burst somewhere or there was a break in the skin and infection got in that way. That was its path, and that's where it settled and started to cook.
Wow.
Yeah. So that was not a pretty one, but I mean, so fast forward to today, he is again almost healed. He is still having home health is coming out and managing it. He's still seeing the wound care center. And, so when we talked about this, we were talking about, when we were trying to coordinate this, we're coordinating it around his home health and coordinating around his dialysis. But a couple of things, Joe, that I want to cover real quick toward the end of this is overall, navigating the healthcare system overall. What are some points that you would love, to briefly talk about, or what are some things what are some advice that you can give to fellow pressure injury patients? What can you tell them from your perspective? What do you think that you want them to hear?
Be aggressive and be vigilant in your own care. And I mean with your caregivers, but also with your insurance. If you're on Medicaid or if you have private insurance, it doesn't matter. Be aggressive. If they want to deny something, fight. Don't be afraid of confrontation in that regard, because you are going to be your best advocate. Nobody else will.
And that's really with all your caregivers too. I mean, be your best advocate across the board.
Yes. Be so plugged in. And demonstrate that, even if you don't have the knowledge that your caregiver might, you probably have just as much, if not more, of what your situation is. Mm-hmm. And don't be afraid to be assertive about it. If something doesn't seem right in your care, call them out. Say, hey, I'm not comfortable in this. Mm-hmm. But it also helps that you develop a good relationship with whoever is the overriding treatment provider. Like in my case, this would be the current wound care clinic that I see for what's left of my wounds. Cause I actually had three or four that I was being treated for. I had the leg wound. I have a wound in my perineal and scrotal area. And I had the ischial side on the left that had opened up again. This is the one that's been, repaired twice surgically. So, there's no more material to move around there. So surgery will not be an option to heal this one.
Right. But you did get it healed. It is healed.
It is healed. It is
currently
100% healed.
Oh, good.
Currently healed. So we are very excited. We are very happy about that. And
Yes.
you're on the tail end.
Yeah.
So
literally and figuratively.
Yeah. Oh my gosh. We are literally on the tail end. I did not do that on purpose.
It's a horrible place to have a wound, let me tell you.
It is.
It's not ideal conditions for healing.
Anything.
Yeah.
No.
In that area.
No, and also, dignity. And we, when you first came to see us, you're like in your very early 40s, if not late 30s, and you've got a butt wound. There's a wound on your butt.
Yep. And but you guys learned early on that dignity is out the window for me at this point. I have no shame. Because there's a little aside. When I was originally in acute for the paralysis in 94, 95, I kind of got left in a hallway for waiting for an MRI, and the sheet had moved, and I'm buck naked to the world, and I don't know it. And I'm dozing off on this gurney in a hallway waiting to get an MRI with the sheet practically on the floor.
Oh, Joe.
Yeah. So somebody finally kind of ambled through this hallway and freaked out because here I am, hello, birthday suit completely. And they're like, oh, we got to fix this. So they're like new sheets and covering me up, and they're apologizing and, just beside themselves with grief about it. And I'm like, what? What did I miss? So I kind of got real cool with people screw up every day and crap happens. There's no use of getting bent out of shape about certain things because it just embarrasses you and embarrasses them, and nobody's happy. So dignity about a lot of stuff in this world of being disabled, I'm totally cool with, because
it's like it's out the window. There you go.
Yeah, I'm not going to sweat it because it could be worse.
That's a great perspective, because it's true.
This is temporary. Yes. This is temporary. I treat everything about my disability, even though it's permanent, I treat it as temporary. It's just what I'm going through today. This is I think I've said this to Jen numerous times over the years, and anybody who wants to meet me and talk to me about anything. I'm not letting the chair define me. I'm in it. I use it. I have to. I have no choice. But it is not who I am. I'm still 6'2", 220, 240 pounds of former lineman, being the local weirdo, dumbass, comic book collector jerk that I always was. I'm not letting it change me. I'm just shorter. I just can't reach. I just can't reach crap on the top shelf.
He's on wheels. Yeah.
I can't climb ladders. Stairs intimidate me. That's about as far as it goes. Everything else is normal, business as usual.
Right. And I have to say, Joe, that was so important. And I always try to articulate this. For us at the Wound Care Center, Joe changed us fundamentally about how we looked at, as nurses, we get into so much nurse mode, wheelchair, offloading, protein, that sometimes we forget that there is a human being in that chair. And a lot of things affect that human being so much. And so Joe brought that human component of disability to the forefront to all of us, to the point to where we would walk around and we would say, well, gosh, if Joe wanted to go to the beach, how do we get Joe to the water? And so, so Joe made disability in the wheelchair. He made it absolutely human and took all of the other pieces out of it. And then his attitude about, we're going to keep going, we're going to keep going, we're going to keep healing. And I think that's the fundamental piece of this story that I really, really want people to hear, is that this has been a journey. And
it's not over yet.
Right.
I accept that. I mean, I've been very fortunate. Again, I'll go back. I had 20 years with no issues whatsoever, which is frankly unheard of
Mm-hmm.
in the wheelchair
That's true.
community. I mean, it's very rare. I mean, it's almost impossible to get through even most people's first years in a wheelchair without some sort of pressure issue. So here's some more things to think about. Your cushioning system is important. Your chair is important. Get with a good provider. Cover your bases. Do the things that you're supposed to do as a consumer. You don't buy a car just because it looks nice. You buy a car because it does what you want it to do. You should treat your wheelchair the same way. And you should make sure that you're on a cushion that is going to give you net pluses rather than net minuses.
Yeah, that makes sense.
So having access to seating clinics, if your facility, wherever you're doing your rehab time, if they've got a wheelchair provider that does a seating clinic, get in it. Find out what your best options are and grab a hold of it, because that's going to affect you greatly. My first cushions were great for that point in my life. And get it reevaluated. If your insurance provider allows you to get, let's say, a new wheelchair every 5 years, and I believe Medicare, Medicaid is that way.
Yep, it is.
And they treat the cushion and the chair as one system. You can't get one without the other. And this is something I learned from my current nurse that comes in and does my dressing changes. She has a patient that is just basically needing a new cushion, and they won't provide just a cushion. They want the full ticket. And the person's chair is just recently new. It's like only 2 years old. So you fight to get that kind of stuff. And unfortunately, if that's the situation, you're going to probably be out of pocket in that situation. And a lot of people can't afford that. Cushions, the cushion that I'm currently on right now, and not to digress too far, is a Roho hybrid cushion. So it's got an air component and a foam type component in it. And that works for me because the way I transfer and my lifestyle. It's a $400 cushion. That's not cheap.
Yeah, they're not cheap.
Yeah, no, they're not cheap.
Not everybody can afford that. Yeah, out of pocket. So I think that there need to be some changes fundamentally as far as that goes for insurance.
Absolutely. Well, one more thing, Joe, just if you could give, since you have met clinicians from across the spectrum, if you could give a couple of words of advice for us, what would you want us to hear from your perspective as being a wound care patient for all of these years? What are some Joe's pearls of wisdom for clinicians?
Gee, no pressure. I would have to think that the biggest takeaway is don't treat a patient like, how do I phrase this? Try not to treat a patient like a slab of meat that you're dealing with. You said it, Jen. We're people.
Yeah.
Take a little effort and get to know the person, and build the person up while you're treating them. Keep them on as positive a path as you can. Some of us are going to require a little more effort than others. I mean, I'm certainly not intending to brag or come off as some sort of all-knowing. But I know that I'm not like the next guy. Again, we talk about attitude and the way I approach things. That's just the way I was raised and wired. Do your best in everything you do at all times. If you fail, you fail. Big deal. Get up, dust yourself off, and try again. I mean, that's the way we grow. A lot of people don't have that tool set in their toolboxes. So as caregivers, if you can start to build that up in those opportunities that you have interacting with a patient, it's important, because sometimes all people need is just a little bit of positive encouragement, and they can start to walk and run the journey themselves. They don't need to have the full tool set. They just need to have a start.
They need one
That's
screwdriver.
great advice.
Yeah.
Yeah.
I mean, that's the best
great
way I can
advice.
put it. Because I went through it when I was in rehab. I had people there at the same time. There were some people younger than me that were going through traumatic injuries and learning how to adjust. There were some people that were older, and some had the tools and the wherewithal to adapt, and some didn't. And I will admit that the ones who didn't frustrated me greatly, because again, I'm young. I don't want to say I know it all. I think I know it all, but there's a certain mindset that you have that if I can do this, anybody can do this. Well,
Right.
no,
Yeah.
not really. And I had to take some steps back interacting with my fellow, I like to say my fellow gimps. I mean, I had to know that my heavy-handed approach works for me, but not for the next guy. So tone it down a little.
Yeah.
But as caregivers, you guys are on the front line. You guys are in the trenches every day, multiple times a day. And I know it's probably hard. Bedside manner for a lot of caregivers is not something you guys learn clinically. But if you're in healthcare to care, then you've got it. You know what to do. It's just sometimes it's hard.
Yeah. Absolutely.
But that's the biggest thing I would say.
Well, that's wonderful. Well, I have to say, Joe, I was so excited to have you on, and I'm so happy that you got to share your insights with the world. I mean, I'm so happy that we got to do this. The whole world.
Yes.
And I think that you have I think we've taken away so many fantastic little pearls of knowledge from you, Joe. And I know that maybe at one point you and I want to do something in person, because in person, we can definitely go off the rails. I will say that much for sure.
Well, that would definitely be wide ranging.
That would be wide. Yes, correct. But again, thank you so much for sharing this incredible journey that you have been on, and you are going to continue to be on the journey. And what I love, Joe, is that you allow me to be a part of your journey. And thank you. I love that. And now we're going to bring Therese in and bring Therese a part of your journey.
That's right.
Awesome.
I know. Now she's a part
The
of it.
more
but
the merrier.
The more the merrier.
That's
The whole
it.
world.
Yes.
We just brought the whole world in for you.
I mean, here's one more thing about it is you're part of a team at this point. You're part of my team, and I'm part of your team. And what's the phrase that is big in corporate America today? Teamwork makes the dream work.
Oh.
Let's jump on a cliche right away, right?
Right away. Yeah. Mm-hmm.
But unfortunately, it's true.
Yeah.
I mean, there is no I in team. I can't do all of this stuff alone. I can get so far by myself, but I am going to need you. As a caregiver, I'm going to need your best effort, and consequently, I should be giving you my best effort.
I love that. I love that.
that's
And
great.
with that, Joe, I am going to thank you so much for joining us today on Healing by Design. Therese, as always, it has been a lovely time. And listeners, thank you so much for joining us. If you ever have any questions or ever have any comments, please, let us know at Healing by Design. Other than that, we will see you on the next Healing by Design podcast. Thank you guys so much.
Thank you.
And that's a wrap on today's episode. Thank you so much for spending time with us. These conversations are why we do this, and we don't take it lightly that you chose to listen to us today. Before we head out, just a reminder, everything you heard today is meant to educate, not to replace the advice of your own healthcare provider. Please don't make medical decisions based on what you hear on this show. Your provider is the right person for that. Our guests share their own opinions and experiences, not the official positions of PAWSIC or anyone who supports this show. If you're dealing with a wound care emergency, please get to someone who can help you right away. And if today's episode was useful, subscribe and share it with someone in your corner of wound care. It helps us reach the people who need it the most.